Hello, doctor colleagues. My name is Dr. Vikram Jaggi. I am the medical director at Asthma, Chest and Allergy Centers in Delhi and Gurgaon. This session, which deals with inhaler device selection. And now let's come to the topic of devices used for inhalational therapy, a few salient features about them, important tips, practical points, and how to select the proper inhaler device for a given patient. Unfortunately, so many inhaler devices in the market that it becomes very confusing. Choices always make you very confused. It's very simple if you have just one kind of biscuit there, but when there are 20 kinds, it becomes hard to select one. But let's make some sense out of this confusion. I'll be talking about three salient types of inhaler devices: meter dose inhaler or the puff, any kind of a dry powder device, that's the second category, and the third category is nebulization. Out of all these, the meter dose inhalers are the oldest and still the most popular, the most prevalent, the most liked actually by the patient. They are very convenient, but doesn't necessarily mean that a convenient device is also a very effective device. Here we have a very convenient device, the commode. But you see what the boy is doing, standing in the commode and pissing outside. So if properly not used, a convenient device is of no use. The common errors in the inhaler are that the patient doesn't breathe out adequately. Synchronization between pressing and inhalation is not proper. Inhalation in an inhaler, in a puffer, MDI, has to be done very slowly. This is important. Patients are not taught about this. Not holding the breath adequately, keeping the inhaler outside your teeth. And then some very funny things patients sometimes do. They are doing the inhaler like this on their body. Actually, some patients have done things like that. You must have heard stories like that. So what is the correct method of taking the inhaler? This is the inhaler. Take the cap off, shake it up and down. Purse your lips and breathe out. Completely. Once completely out, put it in the mouth. Actuate and take a deep, slow breath. Hold it inside. Hold it for 6-10 seconds. Can't hold anymore. Let go. Maybe let go through the nose. The passing medicine might work a little bit over there if there is allergic rhinitis. Mouth rinse, gargle. So all these instructions are to be given. Sometimes an inhaler can be used with a spacer, especially if the inhaled corticosteroids are being used. And generally speaking, adding a spacer adds a lot. The larger particles are settled on the spacer, the smaller particles proportionately go inside. If you are trying to use the inhaler directly, just watch carefully. Our mouth is not bigger than this, and this is that close. See what happens. Most of the medicine is stuck at the back of the throat, and hardly anything goes inside. It's more like a mental satisfaction that I've taken the dose, but it doesn't really work that well. So taking with a spacer is important. There are many kinds of spacer, and the common side effect of hoarseness, because the medicine gets stuck in the back of the throat on the vocal cords, can be minimized to some extent by using spacers. Then we have a second kind of devices which are called the dry powder inhalers, where the medicine is in the capsule form. It is put into the device. The devices could be different. The transparent part goes here. Just makes a hole in that. Breathe out completely, put it inside. But here there is an important difference. Breathe as hard and as long as possible. Breathe fast. So for an MDI, slow, and for a DPI, dry powder inhaler, fast breathing is the correct method of doing. These are some of the common errors people make with dry powder inhalers. I've shown you the correct method of taking, so that was important.
So we have seen that devices, pressured inhalers devices, have their advantages and disadvantages. What if we could take the advantages of both devices into one single device? A step in that direction, and a big step in that direction, is the development of breath-actuated inhalers. This is like an inhaler, but the only difference is that there is no need to coordinate for the patient. The inhalation actually activates the valve and the meter dose inhaler fires when the flow becomes around 20 to 25 liters per minute. So the problem of coordination is circumvented, and at that low flow, even small children, elderly people and patients with relatively low inspiratory flows, severe asthma and severe COPD are able to use it effectively.
Some situations require us to deliver medicines through the nebulizer. We are all familiar with nebulizers. I need not go into that, but there are so many kinds. Some important points. Where are they useful? In very small children, 1 year, 1.5 years, 2 years, 2.5 years, very hard to make a very small child, even with the help of a mother, with an inhaler, spacer or baby mask. Very old people, they are so frail, they are so old that they cannot negotiate all the steps of handheld inhaler devices. Very sick patients. Very, very rarely you come across a dumb patient. You are trying to coach him or her, but he's just not able to learn the sequential steps of the inhalational therapy. And in some situations, for some time at least, you have to just use the nebulizer, because nebulizer is fill it, shut it, forget it, because once you start it, the medicine will coincide with the breath. Some very brittle asthmatics who become very bad very suddenly, who are very arthritic, cannot have because their joints are giving them trouble. So these are some situations. To summarize, use the nebulizer. It is generally felt by doctors who deal with asthma quite a lot that in the real world, nebulizers are overused. We can get by using inhaler, spacer and baby mask in many situations. So use them when necessary. Do not use them when it is unnecessary. Cleanliness of the nebulization is important, and be aware that giving the same medication through the nebulized form rather than through inhaler, spacer and mask can become 4 times, 5 times more costly drug for drug. These are some practical points to keep in mind. Don't use one meter dose inhaler and one dry powder for a different medicine in the same patient, which has got conflicting instructions. It becomes very confusing. Coaching is very important. Coaching for the first time is very, very important. Make sure that the patient, every visit he or she makes to your clinic, is asked to bring the inhaler device. We in our clinic say that if you don't bring your inhaler, we are not going to see you. We'll send you back. Emphasizing that teaching, coaching and learning of the proper technique is highly important for the asthmatic to get control. Now coming to the main subject of this talk, how to choose an inhaler for a given patient. See, the choice can be according to age. For very small children, for example, less than 2 years, you will have to use a nebulizer. For 2 to 4, let us say, you can get by using a inhaler, spacer and a baby mask and teaching the mother how to give that. For a 5-6 year old child, baby mask may not be required. The child can just take it like that. For an intelligent child above the age of 6 or 7, he or she can take the inhaler, he or she can take the dry powder. The choice can be made. In adults, the British Thoracic Society guidelines say that use that inhaler which the patient likes. Now this is a little controversial. Most patients will say that they like this, but many will make mistakes with this. So at least ensure that the patient is taking the inhaler in a proper way. And if this is not working, and many studies have shown that although the patient likes this, but he or she actually does better with dry powder inhaler. So think about that, keep it in mind. We'll have to use different devices for different types of patients. Let's illustrate it with some examples. A 2-year-old child with viral induced wheeze. Inhaler, spacer, baby mask. The best choice. 2-year-old but a family history of asthma. No, don't worry or don't hesitate to make this patient purchase a nebulizer, because the second one, as opposed to the first one, is going to require repeatedly some kind of inhalational therapy. Good to have a nebulizer in the house. 30-year-old intelligent bus driver, a man of limited financial means, but he's intelligent. Inhaler, maybe space, because this requires a certain amount of intelligence to take it nicely, but he can do it, and this is the cheapest. Cheaper than this, much cheaper than nebulizer. chronic asthma with severe fixed airflow obstruction, almost like a COPD situation. This patient will not be able to generate a force, inspiratory force adequate for this. So if the condition is very severe, asthma or COPD, dry powders are hard to use and the medicine doesn't go inside properly. If a patient is already taking an inhaler and reasonably well and comes to you for the first time, please do not change the inhaler device just to show that you're doing something different or you're smarter than the previous doctor. Because it takes a long time for the patient to learn. If it is not broke, don't fix it. If there's no problem, don't try to fix it. So we have seen that selecting the right device depends upon age, we have done that, IQ, severity of disease, etc., economics. Sometimes a good looking device like that is preferred by the younger generation because you can see that this looks almost like an iPod. So it's a little cool, so they don't like this, they much rather like this. So sometimes these things go into making the proper decision. One size is not going to fit all your patients, so keep changing, see which is best. And please remember, inhalational therapy through this is the cheapest method, slightly more expensive, much more expensive. Thank you very much.